Hello guys, welcome back to PhysioNet. In today's video, we're going to talk about diabetes mellitus. What is diabetes mellitus? It's a chronic disease which is either caused due to the production of insulin in insufficient amount or due to the inefficiency of insulin production. It can be inherited or acquired condition as a result of the deficient amount of insulin, glucose concentration in the blood, which is increased and cause damaging of several organs of the body. Most specifically, the nerve and the blood vessels. Types of diabetes mellitus. According to the etiology, type 1 and type 2. Type 1 diabetes mellitus, this is the type which is characterized by the destruction of beta cells in insulin production cells, and thus this insulin is required for survival. Diabetes mellitus, this is characterized by the disorder of insulin action and secretion. Patients have to be relative of insulin deficiency, and it is also known as adult onset diabetes and was also referred to as non-insulin dependent diabetes. Causes. 1. Genetic factors. Diabetes mellitus may be abnormalities in genes present in different chromosomes. This include the genetic defect in beta cells functions, maturation in the mitochondria DNA, and genetic defect in insulin action. 2. Environmental factors. This include the obesity associated with living standard, steady urban of migration, lifestyle changes, like including the consumption of alcohol. 3. Factors with individual. This include production of autoantibodies that destroy the beta cells in the pancreas, deficiency in insulin synthesis and secretion, insulin resistance because of the cell do not respond to the insulin produced, presence of disease that may cause extensively damage to the pancreas, causing pancreatitis, excessive of hormones such as growth hormones, cortisol, glucagon, and epinephrine that antagonize the insulin action, impairment of insulin secretion resulting from the consumption of drugs, and infection which is caused by the virus that causes the beta cells destruction. Characteristics. Percentage of the diabetic pump. In type 1 we have 5 to 10%, in type 2 we have 90%. Age onset. Usually in type 1 we have 30 years, less than 30 years, and some adult. In type 2 we have 40 years and some obsessed children. Pancreatic function. In type 1 usually known, and in type 2 insulin is low and normal or high. Pathogenesis. In type 1 we have autoimmune process, in type 2 we have defeat in insulin secretion, tissue resistance, and resistance of the HGO. Family history. In type 1 is generally not strong, and in type 2 it is strong. Obesity. In type 1 is uncommon, and in type 2 is very common. History and ketoacidosis. In type 1 it is present, and in type 2 it is rare except in stress. Clinical presentation. Moderate in type 1, it is moderate to the several symptoms such as 3P, polydipsia, polyuria, and polyphagia, and fatigues such as weight loss and ketoacidosis. And in type 2, it is mild symptoms such as polyuria and fatigue that is diagnosed on the routine of the physical examination. Treatment. In type 1, it is insulin, diet, exercise. In type 2, it is diet, exercise, and oral antidiabetic insulin. Signs and symptoms. In type 1, we have central In central, we have lethargy and stupor. Lethargy, which means being tired, and stupor, which is not thinking properly. And systematic. In systematic, we have weight loss, and in respiratory, we have cosmal breathing, which is hyperventilation. And in the gastric, we have nausea, vomiting, abdominal pain. And in breath, we have smell of a stone. Here is the end of this video. If you are new to this channel, please subscribe, and thanks for watching.